class, and this is my report. Chapter 18, the medical secretary in a hospital. Most persons, when they hear of a hospital, picture the room where the patient may be staying, a private room, one shared by 2 or 3 patients, or while for nearly everybody has either been a patient in a hospital or has visited someone who was. This may be vaguely aware that somewhere in the hospital there is an operating room, and they know about the admitting information office. The work in a hospital may be roughly divided into 3 main areas: 1 offices, 2 medical services, and 3 records library. Understanding of the discussion here will be made easier by studying the definition of terms used in a hospital. They are given below. Admission record: the form completed in the admitting office containing all the pertinent information regarding the patient entrance diagnosis, personal data, and financial arrangement. Admitting office: the place where patients are received into the hospital and where all necessary information is obtained. Autopsy report: the report of the examination after death. Chart: the patient medical history. Chart holder: a clipboard or clamp for holding the patient's records while he is in the hospital. Clinic: a place where ambulatory patients are treated. Diagnosis index or cross-index: a record of every case treated in the hospital arranged according to disease. Dispensary: a place where ambulatory patients are treated either free of charge or for a small fee. Emergency cassette or accident case: patient admitted for preliminary examination and delivered in inpatient or outpatient apartments as a preliminary case. Face sheet or record: the first page of the medical completed for the admission. Inpatient: patient occupying a bed in the hospital in private, semi-private, or ward accommodation. Master name index: alphabetic list of every patient admitted to the hospital. Outpatients: patient receiving treatment in a clinic or dispensary and returning home after treatment. Postmortem report: same as autopsy report. Register: a chronological list of every patient admitted to the hospital. Service: a division of the hospital such as medical, surgical, or pediatrics. Summary sheet: a recapitulation of the patient's complete history made at his discharge. Administrative office: the secretary in the administrative offices will have to be familiar with the organization of the entire hospital. Her work may concern only one particular department, such as purchasing, diet kitchen, blood bank, or personnel, or she may do the work for one or several of the department heads. As secretary to a department head, her duties will consist of taking care of the doctor's correspondence, his appointments, keeping records, and filing. Admitting office: in the admitting office, much secretarial work is needed, not only in admitting patients and passing them through the prescribed routine, but also in directing patients to the proper department. In certain cases, an advance reservation may have been made, and this must be checked. In the private pavilion, some payment is usually required on admission. Statistical data must be obtained. Copies of the records are sent most or all of these offices. Physician in charge, floor name, superintendent, pharmacy, record library, bookkeeping department, operating room center, switchboard, information desk, mailroom, laboratory. Medical service: the medical departments in hospital are divided into various services. The division depends on the general character of the hospital and an eye, ear and nose hospital. There would be obviously be different departments from those in a general hospital. Secretary in service: the duties of private secretary to the head of a medical department depend, of course, on the specialty. If she works in surgery, her duties may include scheduling all the operations that are performed in the hospital where she works, notifying all nurses, technicians, and attendants who have to be present, seeing that the patient are brought to the correct operating room at the right time, and sending all operating room charges to the business office. Clinic secretary: the clinic secretary plays a crucial administrative role in the smooth operation of a healthcare clinic. They serve as a point of contact between patients, medical staff, and administrative teams, ensuring efficiency and professionalism in daily operations. Follow-up clinics: most hospitals nowadays have follow-up clinics for their ward and clinic patients. The purpose of these follow-ups is to check on the patient's eventual progress or recovery as well as to forestal, if possible, relapses into such recurring illness as cancer, tuberculosis, diabetes, heart condition, and many others. The medical secretary in the records library. The heartbeat of every hospital is the department in which all the patient records are kept. The medical records library, a registered medical records librarian, is in charge of it. To become a medical records librarian, it is necessary to have had at least 2 years of college plus training in a school approved by the American Medical Association. In order to become registered, the graduate of such a school must pass an examination given by a special board. Upon passing this examination, she receives her certificate of registration and is entitled to use the letters RRL, or Registered Records Librarian, after her name. Index of diseases. Safekeeping of the patient's medical histories is only one of the functions of the record library. Another is to keep a record of the types and number of diseases treated at the hospital, services performed, and results obtained, and similar data for study and statistical purposes. To provide a comprehensive file, various systems have been devised for keeping the data contained in the medical histories in such a form as to be readily available for research. Several such systems are now in use, but the system to which most hospitals are gradually changing is the standard nomenclature of diseases and operations. In this index, the human body is divided into 11 principal parts, which are coded as 0. Body as a whole. 1. Integumentary system. 2. Musculoskeletal system. 3. Respiratory system. 4. Cardiovascular system. 5. Hemic and lymphatic system. 6. Digestive system. 7. Orogenital system. 8. Endocrine system. 9. Nervous system. X. Organs of special sense. Additional digits indicate the body region. For instance, take in section 0. Body as a whole. 2. Head and face, 3. Neck and thorax, 4. Abdomen and pelvis, and so forth. Under section 3. Respiratory system, we have 310 nose, 312 nostril, 313 septum, 315 turbinate, 320 accessory sinuses, 330 larynx, 340 trachea, 350 bronchi, 360 lungs. Another set of digits represents the different diseases, disease agents, or operation. For instance, 100 general infection, 101 Diplococcus pneumoniae, 102 Streptococcus, 123 tuberculosis bacillus. By combining the two sets of figures separated by a hyphen, the diagnosis is apparent. That is, the first set of digits indicate the location where the disease occurred, and the second set, the type of disease. For example, 310 to 100, common cold; 310 nose, 100 general infection; 310 to 123, tuberculosis of the nose; 360 to 123, tuberculosis of the lungs. Building a medical vocabulary. Word beginning, peri, around, near, surrounding, term, definition. Periodontitis, inflammation of tissues surrounding a gland; periarthritis, inflammation of tissues around a joint; pericardiectomy, removal of pericardium; pericardium, the sac that contains the heart; pericerebral, surrounding the brain; pericarditis, inflammation around the colon; pericorneal, surrounding the cornea; perigastric, around the stomach; perimetric, around the uterus. Perimyositis, inflammation of the tissue or muscles; periovular, surrounding an ovum;